everybody, my name is Pauline Valeza. I am a student nurse of Catanduanes State University. So I am going to demonstrate to you how to perform
APGAR scoring.
So basically, we have to know the fundamental things in doing such procedure. Number 1, introduce yourself. Number 2, explain the procedure and why it is necessary. So we have to explain the procedure in order to reduce the anxiety and for them to be comfortable. So number 3, observe proper hygiene. So in performing a procedure, you have to basically wash your hands, perform hand washing, or wear gloves, sterile gloves or clean gloves, wearing of PPEs, face masks, depending upon the procedure that you're going to do. Next is to ask consent. So, ma'am, sir, can I ask or can I have a permission in performing such procedures? And, for example, the mother will say, or the patient will say, yes, okay, it's okay for me. Okay. So, okay, ma'am. Next is to inquire the client's history. So, you may ask while performing the procedure, what are the history or the client's history. Another, we are going to provide privacy for the patient. So in providing privacy, maybe the curtains, you have to close the curtains or lock the door. Next is to prepare the equipment. Observe that the equipment is within the proximity. Next is we have to position the patient.
Position the baby in a clean, flat surface. And get ready for the examination. APGAR is a mnemonic, which means A stands for appearance, which determines the skin color. P stands for pulse, which determines heart rate. G stands for grimace, which determines the reflex irritability. The A is for activity, which refers to the muscle tone, and R for respirations, which includes the respiratory effort. So basically, APGAR scale is a quick test used to assess the status of a newborn after birth. So this is performed at 1 minute and 5 minutes. And then assess after 10 minutes if its score is 6 or less. Each category scores from 0 to 2. So the higher the scores, the better the baby's health. So rare to have perfect 10 because most babies have acrocyanosis, which means pink in the upper or blue in the extremities. So in rating the baby, for the appearance, 0 if pale and blue all over, 1 if acrocyanosis, 2 if color pink. Note acrocyanosis, pink upper body and blue extremities. In pulse, 0 if there is no or absence of heart rate, 1 if it is less than 100 beats per minute, and 2 if it is greater than 100 beats per minute. In grimace, so if there is no response to stimulation or stimulus, 0, grimace or no cry, 1, and for active movement to stimulation or the baby's crying is 2. In activity, if there is a flexion of legs and arms, 2. If just some flexion of arms and legs are observed, 1, and if none, 0. Lastly, for the respirations, if there is no or absence of respiratory effort, 0. Weak irregular cry scores to 1, and strong vigorous cry scores 2. So based on the overall scores, it has 5 parts. So if the score got 8 to 10, the baby is normal. If the score is 5 to 7, fairly low, mild respiratory or neurological distress should be considered. So if a score is less than 5, it may indicate neonatal resuscitation.
So hello everyone, I am again Pauline Valeza, your student nurse. Bye-bye!